All right, class. As we continue the spine, we're going to talk about trunk and spinal column muscles. There's a few large spinal column muscles, but a lot of small muscles. A lot of small muscles that you probably haven't heard of, but you need to target. So let's start off with the Erector Spinae, or Sacrospinalis. They're the largest muscle, and they extend on each side of the spinal column from the pelvic region all the way to the cranium. Now, there's a nice set of back muscles right here, right? Again, don't be this guy. Look at this guy trying to do squats on a Bosu ball loaded. No good. You don't need to do this. This is why emergency rooms exist, and this is why you always have a job, because dumb people like this. See, like I said, you can't help stupid. Yeah, there'll always be that guy that will give you a job. All right. So, trunk and spinal column muscles, they're divided into three muscles: spinalis, longissimus, and iliocostalis. The way that I like to remember it is I love sushi. That's from medial to lateral, right? Has attachments in the lumbar, thoracic, cervical, and capital regions, actually made up of 9 muscle segments. So again, medial to lateral or lateral to medial, I love sushi, iliocostalis, longissimus, spinalis. Then you have the sternocleidomastoid and the splenius muscles, large muscles involved in cervical and head movements. Then you've got the large abdominal muscles, lumbar movements. Yeah, this is about me 20 years ago. I try to wear baggy clothes so I don't want you to get, distracted. Just kidding. He is an Indian actor, though. Richard Roshan, I think I showed you a video of him dancing. All right, rectus abdominis, external oblique, internal oblique abdominis, and quadratus lumborum. So rectus abdominis, external oblique, internal oblique, and then transverse abdominis would be if you suck in your belly button, that's your transverse abdominis. Numerous small muscles, many originate on one vertebrae and insert on the next vertebrae, important in functioning of the spine, grouped according to location and function. Some muscles have multiple segments. One segment of a muscle may be located and perform movement in another region, while another segment of the same muscle may be located on another region to perform movements in that region. So it's a little complicated, but basically everything is interconnected, and that's why you need to, when you do core stabilization or when you do back workout, you need to target all the muscles and not just isolate. Many muscles of the trunk and spinal column function in moving the spine and aiding respiration. I think I mentioned to you the diaphragm is one of the most important muscles, and learning to exhale, breathe out is very important because that will help your low back pain. So all thoracic muscles are primarily involved in respiration. Abdominal wall muscles do not go from bone to bone, but attach into an aponeurosis or fascia around the rectus abdominis. So a lot of times in the external obliques, internal obliques, they don't always have attachment to bone, but they'll attach into an aponeurosis or fascia. Here's a nice study here for best upper and lower ab exercises. These are from top-down ab exercises, so going up this way, and then bottom-up ab exercises. These are all based on EMG studies of Brett Contreras and then Jeremy. I will show you, I think I might show it to you right now. It's about 8 or 9 minutes of the best ab exercises, and then I have another video of the best back exercises. And the only reason I show you based on this one gentleman, there's several, but I like it because he uses EMG analysis. And again, there has to be research. Anybody can go on YouTube and say, okay, these are the best exercises, but he actually does the research and does it based on EMG analysis, kind of like what you turned in class. Some of the articles were great. I was surprised to see that half of you didn't do the credit, but oh well. All right, so here's the lower abs. Okay, so targeting this, again, lower abs. This is tough. Oh man, chest, lats, very tough. So I'll show you this video right here. All right. Muscles that move the head. Now you've got the anterior, rectus capitis, anterior longus capitis, posterior longissimus capitis, obliquus capitis, superior and inferior, rectus capitis, trapezius, splenius capitis, and semispinous capitis. You're like, I've never heard of these before. Yeah, because they're neck muscles. You never go to the gym and say, yeah, I'm going to work out my neck. No. But there are a lot of neck muscles, and there are a lot of bodybuilders that will actually put weights on their head and do neck exercises. Lateral, you have the rectus capitis, sternocleidomastoid. Now the muscles of the vertebral column, there's a lot of them. Superficial, there's the Erector Spinae, Spinalis, Cervicis, Longissimus, Capitis, Cervicis, Thoracis, Iliocostalis. So remember, I love sushi. Okay, so I love sushi. So these are the main groups right here. Sternocleidomastoid and Splenius muscles, and the Quadratus Lumborum. This is known to be notorious for low back pain if you get tightness in your Quadratus Lumborum. Muscles of the vertebra, these are the deep ones, and these are the ones that you would do exercises on a Swiss ball or unsteady surface to focus on the multifidi, the rotatories. Okay, so that's the entire spinal column. They stabilize the entire spinal column. So when you're on an unstable surface, such as a Bosu ball, these guys have to work hard to stabilize your spine so that you don't fall. So that's what you're working when you're doing Swiss ball exercises is these. But again, I don't want you to do squats on Swiss ball. Use some common sense. Okay? Now, muscles of the diaphragm, thorax, the number one is the diaphragm. You have intercostalis, external, internal, levator, subcostal, scalene, serratus posterior, transverse thoracic. I'm going to show you pictures of all these. So muscle abdominal, again, the rectus, external oblique, internal oblique, and transverse abdominis. Core training, basically it's dynamic stability for abdominal core for total body function. All too often, minimal attention is given to the link between the upper and lower body, the low back, and the abdominal core. So some attention is given to the inner core as well as the outer core. So you want to do a total body workout. And I'm going to show you some good ab exercises and back exercises as well. All right, so what if you did 100 sit-ups a day? Would you melt the body fat, change in body fat? Okay, all you did was sit-ups. Now remember, we all have abs. People say, I don't have abs. If you didn't have abs, you'd pretty much fall down. But really, it had no real change on abdominal body fat. Okay? So in order to get a six-pack, you must go through a caloric deficit. And this caloric deficit is basically a good natural way to start. And there's a lot of research on this. But take your body weight and you multiply it by 10 to 12. That might be a little extreme. You can start off with 13 as well. And basically, that's how many calories you would eat a day. So if you weigh 150 pounds, if you started at the low end, that'd be 1,500. If you started on the high end, maybe about 1,800. So 1,500 to 1,800 calories. Now remember, calories add up very quickly. So one Chipotle bowl that you get from Chipotle is already almost 1,100 calories. So think about that. Think about what you eat in a day. If you just ate your regular breakfast and had a Chipotle bowl for lunch and then dinner and snacks in between, I mean, you're in 2,000-3,000 calories. So it can add up real quickly. So 1,500 calories is not a lot. Of course, you're going to lose weight, right? I mean, so caloric deficit, it's something that you really need to understand. But people say a calorie is a calorie, but there's a big difference between eating a donut and then eating some oats and some strawberries, right? So you want to pick the right calories. You don't want to just say, a lot of times people say, oh, calories are calories, but you want calories that are not processed. Okay, so here's some good ones as far as fat is concerned: peanut butter, olive oil, coconut oil, fish oil, avocado, nuts. Some good with protein and fat: some lean beef, cheese, steak, chicken, whole eggs. Pure protein: chicken breast, Greek yogurt, canned tuna, egg whites, baked fish, whey protein. Some protein and carbs. So you got some dairy, lentils, buckwheat, beans, and peas. And then for your carbs, you want oats, rice. Whether it's brown rice or white rice, it is rice. Potatoes. I like the purple potatoes. I don't know if you found those. Those purple potatoes seem to have a lower glycemic index, and they don't shoot your blood sugar as much. So purple potatoes are really good. Almond milk, whole grain bread, fruits, veggies, and cereal. And what you want to do, cereal, is you want to try to get whatever is not processed. Not processed meaning dyed or white. And those are usually dyed or chemically altered. So you want to go for the whole grain. So remember, whole grain bread versus white bread. White bread is usually dyed. White sugar is usually dyed. But brown sugar and brown bread, whole grain bread, is not dyed. So it's easier for your body to digest. I've showed you this before, men and women fat percentage. So if you just did diet alone, diet and cardio or diet plus weights. The research shows that diet plus weights is actually more beneficial than diet, cardio, or just diet alone. So diet plus weights is the here. But you can't just go from here to here or go from here to here in a week or two. Really going from here to here, it could take 4 to 6 months. So most people won't stick to their diet and weights for 4 to 6 months. So they usually stop because they go, okay, it's been a month and I don't see the results. But from going from here, it could take 6 months. It could take a year. So that's dedication that you have to kind of put in. And sometimes people lose that dedication because they don't see the results right away. And if you do see it right away, you'll gain it back. So you want it slow, 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 slow. Okay. The inner core, you've got deeper muscles, should be activated first in stabilizing the trunk and pelvis. So the diaphragm, the transverse abdominis, lumbar multifidus, and pelvic floor muscles would attach to the bone ring of the pelvis. So diaphragm, breathing out, transverse abdominis, sucking in your belly button, stabilizing your back, and then stabilizing your pelvic floor. Those are some things that you want to work on, even while you're sitting on the computer listening to Zoom meetings. The outer core, that's the rectus abdominis. Those are your obliques and your erector spinae. Exercise in a variety of means, including but not limited to sit-ups, V-sit-ups, crunches, curl-ups, abdominal twists, prone extension, Superman exercises. So let me show you the best exercises for low back based on EMG. This is a good article or a good video based on EMG as well. All right. Now the nerves, you've got cranial nerve 11 and C2, C3 nerves, sternocleidomastoid muscles, C4 through C8 posterior. You got the Splenius muscles, posterior branches of the spinal nerves, entire Erector Spinae group. You've got intercostal nerves of T7 through T12, that does rectus abdominis. Intercostal nerves T8 to T12, iliohypogastric. Internal external obliques, okay. Branches from T12 and L1, Quadratus Lumborum. So going back and studying for the exam, you just want to know which nerves innervate what. Okay. Muscles that move the head all originate on the cervical vertebrae and insert on a occipital bone. There's 3 anteriors, vertebral muscles. Again, the longest capitis, rectus capitis. All our flexors of the head, rectus capitis, lateralis. So going back and just kind of going and looking at these would be beneficial. But look at this. These are all the muscles that you have in the anterior side of your neck here. Okay, so you got the digastric, levator, scalene, sternocleidoid. Here's your clavicle, trapezius. So here's a funny, good FYI. So you see this bone right here, this hyoid bone. So this hyoid bone actually does not attach to any other bone. It really relies on the muscles and the ligaments to hold it in place. But what they use this bone in forensic science is to tell the difference between if a patient or a victim was strangled or hung. So if they were strangled, what will happen is this fracture will be indented and it'll fracture in. If you hang someone, what it'll do is the rope will come here and it'll fracture out. So they use this bone to evaluate some victims because it's very difficult to break this bone. So if a patient comes in or a victim comes in and it's fractured, they can tell one of two things. It's either strangulation or they hung themselves. And then so that way they can find out. So let me give you an example. Remember Jeffrey Epstein? They found him hung in the prison. And so he hung himself. But what they found is the hyoid bone was actually fractured inwards. Okay, so it's interesting. So that it could be that he was strangled and then made it look like he was hung, or it could have been a fluke thing, but they are looking into that and say, well, how can that fracture be indented versus outward? So, knowing your anatomy and knowing some of this stuff is actually good because you can kind of deduce certain things. Or if a patient comes in and says, oh, I did this, and you're like, that doesn't make sense because you know your anatomy, and you're like, that's impossible, then you know that the patient's not telling the truth. All right? So know your anatomy and your life will be easy. Posterior muscles, muscles that move the head. Again, you've got the rectus capitis, all extensors of the head except obliquus capitis, rectus capitis, splenius capitis. Again, you've got all these. The best thing to do, you don't have to memorize every single one. Okay, just kind of a general concept. So look at this, semispinalis capitis, splenius capitis, levator scap, longissimus. Look at all these muscles. I mean, it's amazing that you have all these muscles back here. Again, here's the iliocostalis, longissimus, and the splenius group. So I love sushi. So it goes from lateral to medial. Splenius capitis, remaining cervical spine muscles are grouped with the muscles of the vertebral column. Now, if we look at the muscles themselves, I just want you to realize, okay, on the exam, I might have just some diagrams and say label this muscle or what is this muscle. So I'm not going to ask origin, insertion, and that's anatomy, but you should know some of these muscles on a regular person. So I might say, hey, what muscle is this? Sternocleidomastoid. I might show a bodybuilder and say, okay, what muscle is this? So you should know that for the exam. I mean, that's something that you should be able to point out. So the sternocleidomastoid is extension of the head at atlantoaxial joint, okay, right side. So the right sternocleidomastoid causes rotation to the left and side bending to the right. So it rotates to the right and side bends to the left. Okay, left side rotation to the right and left lateral flexion. So you should know that what the sternocleidomastoid does. This is a good question right here. Splenius, again, both sides extension of the head, so they extend the head. The right side rotates and laterally flexes. So this one does both sides. So it rotates to the right and bends to the right. Whereas the sternocleidomastoid, the right side, it causes a rotation to the left because of the angle of pull. Okay. So this left one, because of the angle of pull, it will actually cause it to rotate the opposite direction. Whereas this one will cause it to rotate in the same direction. Muscles of the vertebral column, you got the cervical area, longus colli, located anteriorly. Posterior, you got the Erector Spinae group, which is the important group, all run vertically parallel to the spinal column. So these are, remember, the core exercises that I was telling you about while you're doing on Swiss ball. So these are the ones that stabilize your spine. So look at this, the multifidus, the rotatories. So every time there's an uneven surface, these are the ones that are working hard to stabilize your spine. And that's how you get these stronger. Or doing rotations, chops at the gym. Those are good. They lie deep. Okay, laterally flex and extends. Does not rotate the vertebrae. They stabilize the vertebrae. Okay. All right, muscle of the thoracic, posterior, serratus anterior, posterior. You got superior, inferior. So serratus posterior. Okay, that's all back here. Remember the serratus anterior was here, but here's got the serratus posterior here. You got the intertransversus muscles right in here. You got the diaphragm, which is the most important one, responsible for breathing during quiet rest. As it contracts and flattens, thoracic volume is increased and air is inspired to equalize the pressure. When larger amounts of air are needed as an exercise, other thoracic muscles have a more significant role in inspiration. You've got the scalene muscles elevate. Okay, so if your diaphragm is not working properly, what will happen is you'll rely on the scalenes and sternocleidomastoid. So again, if you don't breathe properly, you'll get neck pain, headaches, and discomfort right on here because these guys are working too hard. So if you see a patient come in and they're like, man, you work out your neck, and they're like, no, then you know that, hey, they got an issue with their diaphragm because their scalenes and sternocleidomastoid is working too hard. So if you see someone with an overdeveloped neck and they don't look like they've been exercising at all, specifically just the neck, I'd be concerned because then might be a breathing issue there. Okay, so look into that. Here's the Erector Spinae. Again, you've got the 3 layers. You've got the iliocostalis or lateral layer, longissimus or middle layer, and the spinalis or medial layer. I love sushi. So remember that. Obviously, I've mentioned it many times, so of course it's going to be on the test. Going from lateral to medial, I love sushi. Okay. Extension, lateral flexion, and ipsilateral rotation. So it extends the spine, it side bends, and will cause ipsilateral rotation, so same side rotation of the spine. So right erector spinae will cause right side bending and right rotation, so same side. Here's that Quadratus Lumborum lateral flexion to the ipsilateral side, so same side. Stabilizes the pelvis and lumbar spine, so this guy is very important. Okay, so if you get tightness here, it can cause low back pain. Massage therapists like to get in there and try to see if they can work that out. But again, sometimes it's as easy as getting them to exhale and they'll be able to relax here. So extension of the spine causes the anterior pelvic tilt. So if you've got the hyperlordosis, remember what I showed you the other day, Paris Hilton, J11, and their Quadratus Lumborum is really tight. Okay. Here's the rectus abdominis, external obliques, internal obliques, and the transverse. So those are your four. The rectus abdominis, external oblique, internal oblique, and transverse abdominis. Here's the layer. Now the external oblique, the layers go in towards your belly button. So the fibers come in towards your belly button. And your internal obliques, the fibers go out towards your hip pocket. Okay, so knowing the fibers and how they go. Again, the rectus abdominis, both sides, it flexes the spine, causes a posterior pelvic tilt. Right side, it does a little bit of side bending, but not too much, but really just does flexes. So those sit-ups, planks, curl-ups would do rectus abdominis. Obliques, you would have to do side bends, and then transverse abdominis, you do different ones based on those EMG studies. External oblique, both sides lumbar flexion, posterior pelvic rotation. Okay, so posterior pelvic rotation means your butt is tucked in, versus anterior pelvic rotation means your butt is sticking out. So the right side, lumbar lateral flexion to the right, rotation to the left, and lateral rotation to the left. So look, this is a good question. What do the external obliques do? So basically, they bend the right external oblique bends your spine to the right. So when you're doing crunches to one side, you're getting the right side. But if you were to do rotation, so if you did bicycles where your elbow is touching the opposite side, so then you're working the opposite oblique. So you see how that works? So the right side causes rotation to the left. Okay, and so those bicycles are really good for getting the obliques. Internal obliques, they cause lumbar lateral flexion to the right and rotation to the right. So they rotate to the same way. But if you were doing those exercises, side bends, penguins, they would target the obliques better. The transverse abdominis is basically sucking your belly button, right? You're at the beach, see a good-looking girl, good-looking guy, they're walking by. What do you usually do? You suck in your belly button. Okay, like, yep, all right, how's it going? Yep, all right, cool. And then as soon as they walk by, you're like, oh, okay, I can relax, and your belly comes back out. But that's your transverse abdominis right there. Cervical flexion, you've got your agonists, which are sternocleidomastoid. So to bend your neck forward, your sternocleidomastoid is going to do the majority of it. To extend your spine, you've got the Erector Spinae. Remember, I love sushi. Side bend, you're going to get sternocleidomastoid and Erector Spinae. To rotate, you're going to get sternocleidomastoid. So the sternocleidomastoid works huge, so make sure you know that muscle. Lumbar flexion, you got rectus abdominis, obliques are going to bend your spine forward. To extend your spine, you're going to get the Quadratus Lumborum. So again, if you're in that pelvic tilt, always extended, your Quadratus Lumborum is going to be tight. That's why you get low back pain. Lumbar lateral flexion, you've got the obliques. And then lumbar rotation, you've got the internal and external obliques. Okay. All right, good job.